all clinical examinations have some certain prerequisites, which we call them prerequisites. That is again nothing to repeat. These are simple things actually. There will be proper light. Artificial daylight is always better than artificial light, especially for inspecting the skin color or the color of the some skin and the mucous membrane, and say you are noting the color of the sclera, the conjunctiva. These things, when you are noting the color, this particularly the skin color, daylight is always preferable. Proper exposure is needed, making the subject comfortable. All these things, standing on the right hand, all these things. So clinical examination of the chest, as we have done, for only just for clinical examinations of chest, the exposure is from the neck to the symphysis pubis. For clinical examination of, or we may say the respiratory system, not only the chest, the respiratory system, because breathing patterns or respiratory pattern, breathing will be, has to be noted, both the thorax and the abdomen. Okay. So both the chest wall and the abdominal wall movements are to be noted. Now for examination of the abdomen, it is, if only abdomen, then it is from the costal margins to the knee, it has to be exposed. And abdomen, clinical examination of the abdomen includes examination of the, in strict sense, it includes examination of the genitalia. So it has to be clinical, it has to be exposure. But actually, when in medical practice, when you become medical professionals, it will be like you have to, if you have to examine thoroughly, then you have to actually, first you have to ask the patients to put the clothes off, and then have to cover the subject, or patient, or rather should be called the subject, should be covered with a gown, and whenever exposure is required, you expose and then examine. Maybe you take some history along with, like this you act as a medical professional, and obviously for a male clinician examining a female subject, there will be a female attendant. This is also one of the prerequisites. For a female clinician examining a male subject, there will be one male attendant. There should be one male attendant. So as those who had attended the classes, like if I can get from this roll number, who is roll number? Okay, you say you had attended the class. So clinical examination of abdomen, again the headings which under which we studied as professionals, we will act like we are taking the history, talking to the patient, and going on simultaneously examining, maybe measuring the blood pressure like this. So again, general physical examination followed by systemic examination. But under the, what are the four broad headings under which we examine any clinical system? Yes, auscultation is with the stethoscope. That means hearing, trying to look or identify sounds with the stethoscope. So what we see on inspection of the like inspection of the chest, we see certain things. In examination of the abdomen, what do we see?
Color, shape,
so that is color of the skin, any scar mark, shape is still okay. In case of respiratory system or the chest, we talk about symmetry. In abdomen also there is nothing such, there is not like that. There is on inspection there is to note about much about symmetry till we can call shape and symmetry. The shape of the abdomen, whether the abdomen is like usually our what we call in layman's term, the belly is bulged upwards. In supine position we should call it upwards or forwards in the anatomical position. If it is opposite of that, that shape of the abdomen is called what type of? You were there? Yes. Next, you were there in Friday's class. What type of shape is that called? The opposite. The bulging is, that means it is not bulged, rather it is depressed. So what type of that is called? That is called a scaphoid abdomen. Okay, scaphoid abdomen. Okay, in severe malnutrition, in certain, yes, sunken abdomen or scaphoid abdomen. So this is noting the shape, any scar mark, distended veins, engorged veins, like in the abdomen, what may be there? If the inferior vena cava is obstructed at some level, which is returning the blood from the inferior to the heart, to the right ventricle. If the inferior vena cava is obstructed, then usually there are engorged veins over the abdomen. If the portal vein is obstructed, portal vein, you have read about the portal vein in the GI tract. So portal vein is obstructed, there are radiating veins, prominent, distended, bluish These blue colored veins are seen around the umbilicus, as if they are radiating from the certain blood vessels, as if they are radiating from the umbilicus, but that is due to portal obstruction. So these things we have to note during inspection of the abdomen. So you were there on Friday? No. So okay, tell me what, but still from your common sense what we have discussed, you have done the respiratory system, general physical examination, you have not attended classes. Why? You are ill. Did you attend the examination? First internal examination? When did you join? But you did not attend the most of the clinical physiology classes. Last week you did the CVS. Okay, just from your whatever knowledge you have, basic knowledge, you just tell me one point for do you know what is palpation? Palpation means? What is palpation? What does the word palpation mean? Or we are talking about inspection, palpation. Like we told, auscultation is trying to identify sounds with the help of the stethoscope. Like palpation means what? Feel with the hands. Clinicians' hands are feeling the some part of the subject's body. So by palpation over the abdomen, what can we feel for? Just say from your common sense, like, or whatever have we discussed in whatever, even if you have little clinical little knowledge, what can we feel for? We can feel that for over the other body parts also. So also for the abdomen. Yes, yes, that is the palpation of the organs, that is specific for the abdomen. But do we feel for something, say on the nape of the neck with the back of the hand? We feel for what? Nape of the neck with the back of the hand, over the forehead? Temperature. So like that. So temperature and first is, so first point, simple points. If you before going to organomegaly, simple points, temperature and tenderness of the local temperature and tenderness. We note tenderness, any area, or the subject is complaining of a pain in a specific area, it is paining on the right upper part, or this part, the subject is showing with the finger or the hand that this part. So you just press over that area gently, and that pain again may be felt. So feeling is, the subject is feeling the pain, that is the symptom, and we will tell that this part of the belly or this part of the abdomen is tender. So as you have done if you have attended anatomy classes, so you know the 9 regions of the abdomen which we classify according to 4 imaginary lines. What are those imaginary lines? Yes, in vertical lines are both going through the mid clavicular lines. Yes, one is subcostal. So if we have to, for clinical examination, we can be simple. Okay, we can simply tell these 4 lines as 2 are going through the middle of the clavicle, straight lines, vertical lines downwards, and 1 is through the subcostal, that subcostal plane, or 1 imaginary line connecting the lowermost costal cartilages, and another imaginary line connecting the 2 iliac crests. These can be 4 lines which dividing the abdomen into 9 regions. So the regions are, so if you have to tell, you have to just tell in one order. Say the right, which is the right uppermost? Right hypochondrium. Then left to it comes the, no, right, left to right hypochondrium is the epigastrium. Then the left hypochondrium. Below the left hypochondrium, left lumbar. Then right to it, umbilical region. Then right lumbar. Below right lumbar, right hypogastrium. Then middle of below umbilicus, hypogastrium. So sorry, not right hypogastrium, it is right iliac fossa. Right iliac fossa, below umbilicus is hypogastrium, and that is again left iliac fossa. Now these are the 9 regions. We will require it during palpation. What we do, so to locate organomegalies which is not very that means commonly organomegalies may be found, but organomegalies, at least in the first year of your medical school, as you are examining your own subjects, you won't see organomegalies, you only know the procedure. Okay, you only know the correct procedure. So, the classical way to find for any possible hepatomegaly is start from the right iliac fossa and go pressing at the height of inspiration, and to relax the abdominal muscles, first you have to ask the subject, you fold your knees, you when you examine the, yes, semi-flex, but don't, again I repeat, when you instruct the subject, you have to speak in a way that the subject understands, a layman understands. So, don't go like this, flex your elbows, semi-pronate your wrist, that you have to do, either you have to show pulse examination semi-pronate, no, you cannot say like this to the subject, you should not say or must not say semi-pronate your wrist at your wrist joint, the subject will not understand anything. So, you have to show, do like this, or you have to do it passively for him or her. You have to hold, okay, I am just holding, I will examine your pulse, cooperate with me, and these lines, this is a part of communication, basic communication. So, you have to communicate like this. So, you fold at your knees, actually it should be flexed, semi-flexed at the knees and also some flexion at the hip joints, but probably hip joint flexion like that, it will, the subject will not be able to follow properly. Semi-flexion of the knee, folding the knees is more or less sufficient. Relax the abdominal muscles, then at the height of inspiration each time you go on pressing, and you go upwards from the right iliac fossa and just go on gently pressing at the height of inspiration. At the height of inspiration, any it will be more prominent at the height of inspiration. If there is any organomegaly, liver grows from upwards to downwards, then it will be found. Again, borders of the liver can be done on percussion. Okay, so percussing from above, you get resonating sounds over the lungs, you percuss the intercostal spaces, then probably at the fifth intercostal space, sixth intercostal space on the right side, dullness starts. So, that is the liver overlapping the normal resonating, that means lung tissues. So, that is, again it is not, that is, it is not a that, okay, or obvious, most cases it will be the liver, but whenever you get dullness, it does not have to be the liver only. Whenever you get dullness, usually they are due to the normal organs covering the or lying over the normal lung tissue, but there may be a abnormal growth also. So, that can be confirmed only by imaging, but still usually we expect the liver dullness to start from the fifth, sixth right intercostal space. So, the liver dullness, and you will say better than me, probably there is the which lobe of the liver? Right lobe. So, there is a, so why I go on telling that you must practice, you must see the bones, you discuss among yourselves, practice clinical examination during or attend revision classes, contacting with the anatomy department if possible on specimens, because during the exam, due to the sheer pressure or the vastness of the syllabus, students go on making simple mistakes. Even all students, even we used to make, all students, there is a potent chance to make simple mistakes. Like just by the sheer pressure, exam is going on from 9 am, say a specimen is shown to you at 5 pm, you had some a little bit of lunch maybe at 2 pm and again come for the exam, is going on till 5 pm and the examiner is also tired, just showing a specimen of the liver in which the left lobe has been removed or something like this. Have you seen such specimen? Or maybe the examiner is pointing out which is this, pointing out the left lobe and saying which is this. The student also knows that this is the left lobe of the liver, but the word which is coming out of the mouth is this is the left liver or this is the right liver. So, that is wrong. Liver is single, liver is one containing the left lobe. That is due to the, just due to the pressure of the examination and just the tiredness or wearing out, the mind has weared out. So, these things become, so as you go on practicing, when you take the liver specimen and revise it with your friend 1 or 2 times, so these chances of these mistakes become less, and when you know that these mistakes can occur, you can avoid that. These things occur during the exam. So, what we are talking about is percussion of the liver, not percussion of the liver. By percussion we can identify the borders, By palpation we can go for organomegaly. There is nothing, there is no point in describing much. For the spleen, we go from right iliac fossa to the, we have to show it, we have to do it and perform. So, from the right iliac fossa towards the left hypochondrium we approach. Same, relax the abdominal muscles by folding at the knees, maybe folding at the thighs also, flexing, and then go for, then just gently press at the height of inspiration. What is required in for the kidneys, again it is not very easy for the, especially for the first year medical students. Even kidney is difficult to palpate. One word is there, bimanual palpation is necessary. That is, both hands has to be used. One has to support the your non-dominant hand, the left hand, probably most of us are right-handed, left hand. So, in the books it is written left hand supports the posterior aspect of the lumbar region, whichever right or left, and the anterior aspect is, we have to try to feel it from with the anterior. Again, kidney organomegaly is difficult to find in the abdomen, especially in obese people it is more difficult to find, but still we know the procedure, so that actually when you go to the words you can do it. But again you have to remember, when now this is a defined syllabus, syllabus is defined by the NMC, all over the country it is the same syllabus. So, you may be asked, usually what we found in earlier days before 2018, clinical examination of the abdomen was probably discussed, one or say one class was taken, it was discussed, but it was almost never asked in the exam, for the first year students, it was never asked in the exam, but nowadays it is defined in the syllabus, and even we left out some difficult topics in 1 year for the second batch, I think. So, the examiner told us, so where are the charts and all in case of this amphibian practical. So, we told that some difficult charts we have left out, but the examiner told the convener that this we are discussing in our college and this is in the syllabus. So, these things will happen. The syllabus is defined, so we whatever is in the syllabus we have to discuss and we have to keep it for the exam. So, clinical examination of the abdomen can be asked. So, one thing, that is by palpation, we look for organomegalies by percussion, not only these borders of the liver, but also by percussion we go for something called the shifting dullness. If the abdomen is filled with fluid, if it is filled with greater amount of fluid, very great amount of fluid, then probably this dullness won't be, that means there, because there is actually what is shifting, fluid is shifting. So, we get dullness, we start percussing from the center or start percussing from one side. So, there will be one area where there it will be finding dullness because of the fluid. Now, when the subject is lateralized to one side, in clinical terms this is called left lateralization or right lateralization. One person is lying supine, so left lateralization to turn him to the left side or asking him to turn him or her to the left side or to the right side. After lateralization, due to gravity, fluid settles to that side, so the other side becomes resonant. Now, the dull areas become resonant, this is called shifting dullness. But just from common sense, if the abdomen is almost fully filled with fluid, the abdominal cavity, then there is no place for the fluid to shift. So, shifting dullness is absent or shifting dullness is not identifiable. Likewise, if there is considerable amount of fluid, again for shifting dullness is probably found more when there is not very little fluid, then in fact the dullness cannot be identified, but there is some amount of fluid but not very great. But in case of considerable amount of fluid which is not very less, but not fully filled but not very less, there is something which can be appreciated is the fluid thrill. So, we have asked the subject himself or herself or the assistant attendant to keep one hand over the like vertically over the abdomen in the central part, and we keep the palm of our non-dominant hand, maybe the left hand on one side, and tap with another side from with this tap like this from another side, and that thrill can be felt. As we told in the CBS, palpable murmurs, whatever soft sounds we heard here with the stethoscope, probably mainly the bell of the stethoscope, mostly the bell of the stethoscope to pick up soft sounds, palpable. They are called with the hand, surface of the hand or palmar surface of the hand. They can be felt as thrills. So here we feel that fluid thrill on the palm of another hand. That is about the fluid thrill. And auscultation over the abdomen, we look for or try to identify peristaltic sounds. Again, peristaltic sounds in the intestinal peristalsis may be normally maybe 5 to 6, maximum 8-10 waves per minute. So we have to be very careful. The ambient should be good so that we can pick it up. Ambient should be good means favorable, that means not much noise outside. So the abdominal peristaltic sounds to be picked up by the stethoscope. Okay, and one classical example to pick up with the bell of the stethoscope, that is we will learn in obstetrics, that is placing the bell of the stethoscope over a pregnant woman's abdomen. Okay, so what can be picked up is the fetal heart sounds, but in non-pregnant females and males, peristaltic sounds have to be picked up by the abdomen. In cases of intestinal obstruction, obviously distal to the obstruction, peristaltic sounds will be absent. But again, to pick up peristaltic sounds, we have to hear carefully. We have to try to listen carefully. So these are some things, but it is not very, that means ideal to just go on discussing about this. We have to practice. That is for fluid thrill. Then you do the ekhane tumi fluid thrill pabe na. You won't get fluid thrill. Why? Why you won't get? I think probably you lie down that side. Lie down that side. Tumi right side edik theke koro. Come to the right side for the clinical examination procedure. In the first year, we are concerned about. Okay, you may lie down. In the first year, we are concerned about the proper way of doing it, not the findings. So তুমি যেটা করছো, when you look for fluid thrill, first সেই সময় অত relaxation এর দরকার হয় না. So the relaxation is required. Do you understand Bengali? No. So relaxation is required during organ palpation. So again you have to ask the subject, you have to make her straighten the knees, and now for the fluid thrill you have to put the hand here like this. So you cannot put your own hand because you have to use your two hands for feeling. So you ask another person or the subject herself. So practice the proper way. Where is your books? Where are your books? You should have one book. So practice the proper way. Findings are not that important in your first year. You will organomegaly you won't find, fluid thrill shifting dullness you won't find, because abdominal cavity fluid is only during disease state. So we are all probably healthy people. Okay, so you do the right procedure. তার মানে হ্যাঁ ওইভাবে নয়, হ্যাঁ ঠিক আছে, মানে সাবজেক্টকে প্রপার ইনস্ট্রাকশন দিয়ে যখন তুমি লিভার স্প্লিন ফিল করছো, মানে আমরা সাধারণত কি করি তাই না, হোয়েন ইন মেডিকেল প্র্যাকটিস সাবজেক্টকে লাই ডাউন করালাম, অন্য সব কিছু দেখলাম, লিভার স্প্লিনটা যখন দেখবো খালি সেই সময় বলে নেবো যে হাঁটুটা এবার ভাঁজ করুন, ওই সময়টুকু দেখে নেবো, আর অন্য সময় নয়। একদম সোজা শুয়ে থাকো, যেরকম ভাবে একটা লোককে যদি শুতে বলো সে কিভাবে শোয়। এবার তুমি ধরো লিভার প্যালপেশন করার জন্য কি প্রপার ইনস্ট্রাকশন দাও, করো, বলতে হবে। ওরকম ব্রিদিং নয়, পাটা ভাঁজ করুন, জোরে জোরে শ্বাস নিন এবং সোজা, মানে বাংলায় যেভাবে নর্মালি একটা লেম্যানের সাথে আমরা যেভাবে কমিউনিকেট করি, আমি আপনার পেটে হাত দিয়ে একটু পেটটা টিপে টিপে দেখবো, আপনার যদি কোনো অসুবিধা হয় আমাকে বলবেন, যদি কোনো সামনে কোনো সমস্যা হয় বলবেন, না হলে আপনি জোরে গভীরভাবে শ্বাস ছাড়তে থাকবেন। ডিপ ইন্সপিরেশন সবসময় দরকার হয় না। তো আপনি নর্মাল আপনি শ্বাস প্রশ্বাস নিতে থাকবেন, আমি দেখবো, দেখা হয়ে গেলে আপনাকে জানাবো, কোনো সমস্যা হলে আমাকে বলবেন। সিম্পল এইভাবে বলে তারপর করবে, তারপর করো। এক তো কমিউনিকেশনে আই অ্যাম প্যালপেটিং ইউর লিভার একটা লেম্যানকে বলার মানেটা কি? বলছি যে বলো যে পেট টিপে টিপে দেখবো, এর চেয়ে সহজ ভাবে বলার কিছু। I'll just examine your abdomen. If you can't, you have to tell in Bengali. এইখানে পাবে, এখানে কোনো বাঙালি পেশেন্টদের পাবে। You have to practice now speaking in Bengali. No, this is right iliac fossa. Superficial means? So what are you trying to mean by deep examination? No, where have you got these terms, superficial and deep? We have nothing called superficial and deep examination. So you have to superficial and deep, superficial examination, deep examination. There are no clinical terms like this. What is this? That you can tell this, that I am trying to locate the liver, that is locate the organs, then that may be. But there are no actually clinical terms. Superficial and deep examination. Maybe temperature, tenderness you are feeling for, these are superficially. Maybe organomegaly, you are looking for the organs, that is you are going deep. At the height of inspiration or better deep inspiration or normal inspiration, you have to press the subject. But I don't think there are clinical terms such as superficial examination. There are in reflexes. When you are doing the CNS, there are terms: superficial reflex, deep reflex. So that will do when you do the CNS. So just breathe in, breathe out. So we start from the right iliac fossa and try to go under the costal cartilages. Now this is the classical method, but not randomly like this. I just told for the purpose of showing you. Whenever that inspiration will be deep, then only do this. And when we are suspecting that yes, there should be liver, but still not finding by the classical method, then you go here, support here, and try to hook under this right costal, lower this costal margin. Try to hook your fingers. Likewise for the spleen, you go to the left side. That is one area where we have to go to the left side. When classical method for finding the spleen from the right side to the left. That is the hooking method. And for this also, spleen also, hooking method is not used first. Classical method is used first. If we do not get, then we go to the left side and try to hook with our, maybe with the left hand, if it is better to comfortable for us with the left hand. No, for liver palpation আমরা রাইট সাইডই করব। স্পেসিফিক্যালি ক্লিনিক্যাল এক্সামিনেশনে আমরা তো ধরে নেব না রেয়ার কেসেস লাইক হার্টে আমি যদি এপেক্স বিট না পাই, একেবারেই না পাই, হার্ট সাউন্ড, হার্ট বিটই পাচ্ছি না, স্টেথো বসিয়ে ডান দিকে বাঁ দিকে, দেন উই মে ট্রাই টু লোকেট অন দ্য রাইট সাইড দিস রেয়ার কেসেস লাইক ডেক্সট্রোকার্ডিয়া অ্যান্ড অল। এখানে আমি ধরে নেব লিভার রাইট সাইডেই আছে, পাচ্ছি না, হুকিং মেথডের চেষ্টা করবো। তারপর তো এখনকার দিনে ইমেজিং এগুলো আছে for those rare cases. তো সেইটা হচ্ছে। আর কিডনির ক্ষেত্রে লাইক দিস, কিডনির ক্ষেত্রে usually it is not asked, we may ask to turn এখানে right posterior aspect of the lumbar region and try to locate it with the anterior, with the right hand anteriorly. Right hand means dominant hand, mostly right hand. So as if we can push the kidney if it is palpable. Now it is very difficult. Just if you can show the method that we are trying to put the hand support and locate from here, it is sufficient for first year. Bimanual palpation, say kidney will just be displaced some bit and it will be possible to fill it with the right hand enlarged kidney. This is very difficult to actually. First thing is, without any organomegaly, organs are not palpable. Abdominal organs are not palpable unless they are enlarged. So first thing is, in first year you cannot find any enlargement as you are doing your own subjects. There we are probably not disease person, so we cannot find. We have to concentrate on the method only. Classical method for liver and spleen with hooking method and bimanual palpation for kidneys. Same thing like liver. জোরে শ্বাস নিন। No, you don't have to turn. Just fold your knees. You breathe normally. Like this, probably you should get within the left costal margin. The idea to turn the head is so that, why is it required to turn the head? It is no, not a part of the clinical. You turn the head means the subject does not breathe on your face. That's why, that is the reason. Like in the respiratory system, when you hear the breath sounds, ask the subject to turn the face. No, organomegaly ছাড়া organ palpation কোনো finding পাওয়া যাবে না। এটা জাস্ট প্রসেসটা জেনে রাখবে, ফাইন্ডিং ওখানে ওয়ার্ড।
অসকালটেশনে বলছি যদি ডিফারেন্ট সাউন্ডস পাওয়া যায় তাহলে কিভাবে বুঝবো অ্যাবনর্মাল কি নরমাল? ওটার এখন দরকার নেই।
অ্যাবনর্মাল সাউন্ড কিভাবে? পেরিস্টলটিক সাউন্ড ছাড়া কি কিছু অ্যাবনর্মাল সাউন্ড পাচ্ছ কি? আগে নরমালটা দেখো। এখন একটু সাইলেন্ট অ্যাটমসফিয়ারে ঘরে করবে, পেরিস্টলটিক সাউন্ডটা বোঝার চেষ্টা করবে। আর তাছাড়া আর সেটা মানে পেরিস্টলটিক সাউন্ড কিন্তু এরকম হার্টবিটের মতো নয় যে 72 পার মিনিট, 80 পার মিনিট, 90 পার মিনিট, 6 হ্যাঁ ওইরকম ওয়েভ পার মিনিট। এটা কি দেখছে? কিডনি ওইভাবে দেখে না। Kidney just press bimanual. For kidney, you don't have to press repeatedly. It is bimanual palpation, just supporting with one hand and trying to feel with the other, not doing it repeatedly. The right kidney is palpated by placing the left hand posteriorly in the loin. Loin is the same region. Okay, when you will read about urinary kidney stones in surgery, you will read pain shoots down from loin to groin. So loin is this region. Back of this near mostly the lumbar region, while placing the right hand anterior in the right lumbar region. As the patient takes a deep breath, the two hands come closer as the left hand pushes forwards and the right hand pushes inwards and upwards. Okay, but not like this. At the same time, okay, the lower end of the kidney is now filled between the fingers of two hands, but this is very difficult to find actually. Similarly, the left kidney is placed by placing the left hand posteriorly in the loin region and placing the right hand on the left lumbar area. This is considering that right hand, this is telling by considering that the right hand is the dominant hand. During a deep breath, the left hand is placed forwards and while the right hand is placed backwards, inwards and upwards. The two hands come closer and an attempt is made to palpate the kidney between the fingers of two hands. Normally the left kidney is not palpable unless it is enlarged on very low in position. কোনো কিডনি কোনো কিছুই প্যালপেবল হবে না, এটা ধরে নিয়েই তুমি এখন করো, নাথিং উইল বি ফাউন্ড অ্যাকচুয়ালি।